Okay, blood pressure. This is your blood pressure cuff. It is an adult size. They come in pediatrics. They come in adult larges, thigh cuffs, adult smalls. Make sure you have the appropriate size cuff for your patient so you get the correct reading. This is your dial and your pump. Your pump has a little valve on it and then the little dial. Make sure you play with that, get familiar with it. It's what lets the air out of the cuff itself, controls the flow from it. Your readout has a series of numbers on it, starts at 20, goes up in increments of 10. So 20, 30, 40, 50, so on and so forth. In between that, increments of 2. So 20, 22, 24, 26, 28, 30, so on and so forth, all the way up to 300. Okay. The dial itself also has a little clip on the back. Clip it to the little strap right there, or on the cuff itself, shirts, whatever it is you need, just so that it's within view. Okay. The little white line here, the index line, needs to go in between the range, and that's how you have an appropriate sized cuff. If it doesn't fall within that range, you're not going to get an appropriate reading, so you need a different size cuff. Size appropriately because it can really skew the reading itself. Okay. Your stethoscope, or your ears as we like to call them, make sure you set them up correctly so that way you're angled and they're facing one way or the other, doesn't matter, but they're facing in towards the eyes when they're in your ears. It's the way of the ear canals, and you'll get better sound this way. They won't be muffled. Once they're on, do a little tapping sound like you see in the movies. Make sure that it's facing the correct direction. Most bells will spin, and they'll have one side that's audible and one side that's not. So play around with it and make sure you're good to go before you start. With taking a blood pressure itself, we're going to go ahead and put the cuff around the arm, making sure we do it right above the antecubital fossa, lining up that marking with the area of the antecubital fossa, right at the inside of the elbow. Attach your dial to your blood pressure cuff or wherever you want so it's within sight. Take the time, make sure you're not a tangled mess. Put your ears in, get ready to go with all that. We're going to find our pulse in the radial of the wrist. Once we find that, we're going to go ahead and pump the cuff up until we no longer feel the pulse. This is called pulse obliteration. And once we no longer feel the pulse, we're going to give it a good solid 1 to 2 pumps, depending on how big your pumps are, making sure we fully obliterate it. And we're going to then put our stethoscope right in the antecubital fossa, right below the blood pressure cuff. And we're going to slowly release the air with the knob, letting it out at a very smooth, controlled rate, watching for that needle to have a nice slow descend, listening for the first audible thump we hear and the last. That'll be our systolic and our diastolic numbers. Once we're happy with that, we'll release the rest of the air and we're good to go. Again, though, we're going to find that radial pulse. Right? Once we find it, we're going to go ahead and pump the cup up all the way until we have pulse obliteration, and then go a few more higher, just like before. Apply our stethoscope through the antecubital fossa, making sure we're not covering the back of the bell. Go ahead and release the air. And once again, listening for that first thump we hear, corresponding with the number that it's at, and the last thump that we hear, corresponding with that number, will give us our systolic over our diastolic pressure. And right here, I get about 130 over 88. And we're done. That is a blood pressure.